This is Lisa Schwartz. I'm one of the pharmacists on staff at the National Community Pharmacists Association. Keep listening for answers to the questions community pharmacy owners ask us about the Medicare Part D Star Ratings program. The number one most frequently asked question is, how do I find out my pharmacy's star rating? At this time, Medicare does not give star ratings to individual pharmacies. Pharmacy claims data is analyzed in the aggregate, that is, chains, independents, and mail together to assign a star rating to a Medicare Part D prescription drug plan, PDP, or to a Medicare Advantage plan with prescription drug benefits, MAPD. I'll touch more on this later, but just because Medicare isn't looking at individual pharmacy performance doesn't mean that Part D's plan sponsors and commercial plans aren't doing their own analysis. How do I find out if my pharmacy is helping or hurting the plan's ratings? Pharmacy Quality Solutions, PQS, has created a tool that translates claims data into a pharmacy-specific scorecard to track performance. The Electronic Quality Improvement Platform for Plans and Pharmacies, or EQIP, dashboard displays your pharmacy's score, color-coded for a quick comparison to goals for 3, 4, and 5-star plans. Several wholesalers, pharmacy services administrative organizations, franchises, and other groups have secured access for their customers. Find out if your group or pharmacy can access this scorecard by checking the news page of www.pharmacyquality.com. What are the pharmacy quality measures that factor into a plan's star rating? There are 5 pharmacy quality measures that are currently part of the Medicare Part D Star Ratings program. High-risk medication use. The list of high-risk medications is similar to the Beers list with which most pharmacists are familiar. However, the list of medications analyzed for this quality measure is maintained by the Pharmacy Quality Alliance at www.pqaalliance.org. Diabetes treatment looks at the percentage of patients with diabetes who are prescribed renin-angiotensin system antagonist, RASA, which of course includes the ACE inhibitors and ARBs. Medication adherence for oral diabetes medications looks at the percentage of patients who adhere to oral diabetes drugs, specifically the biguanide metformin, sulfonylureas, thiazolidinediones, DPP-4 inhibitors, incretin mimetics, and meglitinides. Hypertension medication adherence looks at adherence to renin-angiotensin system antagonists, and cholesterol medication looks at adherence to statin drugs. For these last 3 adherence-related measures, patients must be 80% adherent to be counted in the numerator of the equation. For a full year, they must have medication to cover at least 292 days. Why is there a sudden interest in measuring pharmacy performance? The interest and buzz around measuring healthcare quality comes from health plans wanting healthy members and wanting to avoid spending money on services, tests, and treatments that do not improve health outcomes. Prescription drug costs are no small part of overall healthcare spending, so measuring pharmacy performance is a step toward ensuring that prescription drug costs result in better outcomes for patients. There are additional incentives in the Medicare Part D Star Ratings program for plan sponsors. Medicare Part D plans with 5 stars are allowed to market the plan year-round, and beneficiaries may make a one-time switch into a 5-star plan outside of the open enrollment season. Plans that have a lower than 3-star rating may be terminated after 3 years. How do I improve my performance on the 5 quality measures tracked by Medicare? Well, remember that 3 of the 5 measures are adherence-related. Coordinated refills and regular contact with a local pharmacy have been shown to improve adherence. Talk to patients about adherence and ask about side effects or recent drug therapy changes. Many pharmacy software systems have programs that help pharmacies identify maintenance medications due for refill, but automatic refills fall short when the communication with the patient is not part of the picture. There are lots of resources and tools available to help improve patient adherence to medications. Contact NCPA for information about the Simplify My Meds Coordinated Refill Adherence Program. Become familiar with the list of high-risk medications and be prepared to intervene when a Medicare patient presents a prescription for one of them. It's a good idea to have an alternative in mind when you contact the prescriber. Finally, identify diabetes patients who are not filling a RASA prescription. If a patient had a prescription, ask why it was stopped. If a patient has never been prescribed a RASA drug, discuss the benefit to the kidneys and contact the doctor with a recommendation. What else figures into the rating? In the 2015 plan year, there are 14 measures for PDPs and 48 for MAPDs. Prescription drug plans are rated on call center customer service, the appeals process, and patient safety. Medicare Advantage plans are also rated on health screenings, vaccination rates, and managing chronic conditions such as diabetes, osteoporosis, blood pressure, and fall risk. Patient safety measures are more heavily weighted, and the pharmacy measures fall into this category. Do non-Part D plans have star ratings? Well, no and yes. What I mean by that is the star ratings program belongs to the Centers for Medicare and Medicaid Services and rates Part D, Part C, or Medicare Advantage, nursing homes, and dialysis centers. Meanwhile, other plans and PBMs will, if they don't already, use the same pharmacy quality measures used by CMS and published by PQA. PQA has 14 quality measures, though CMS uses only 5. For more information, visit pqaalliance.org/measures. How soon will the star ratings program affect my pharmacy? The star ratings program affects your pharmacy right now. While the preferred networks that popped up in 2012 plan year appear to be based on business negotiations instead of performance, CMS has released reports of claims data analysis that show preferred networks did not always lead to lower cost savings over pharmacies not in the preferred network. Other effects: legislation has been introduced that would allow any pharmacy located in a medically underserved area to participate in all Medicare Part D plan networks, including the plan's discounted or preferred network. Non-Part D plans are also developing pay-for-performance programs to incent pharmacies to reach quality goals. What happens if I do nothing? Well, if you are already meeting performance goals, keep up the good work. While some plans look at pay-for-performance bonuses to be paid to high-performing pharmacies, it may be more realistic that pharmacies just get to be included in the network or in the preferred network. Please don't become complacent. The star ratings program may add more quality measures or change the goals. Currently, CMS is using CMR completion, excessive dose of oral diabetes medication, and drug-drug interactions as display measures. They will see the aggregate pharmacy performance, but it won't affect the star rating currently. If you aren't meeting performance goals, your patients might not be meeting their goals either. They may be taking inappropriate medications, they may not be taking medications they should, they may be experiencing unnecessary adverse effects, and your patients may not meet their drug therapy goals. Additional consequences might include finding out that a Medicare Part D plan could exclude you from its preferred network in order to improve its star ratings, and plans may steer patients to a pharmacy that does meet its pharmacy goals. Thank you for listening to this discussion of frequently asked questions about the Medicare Part D star ratings program and pharmacy quality measurement, brought to you by the National Community Pharmacists Association. For additional help, contact info@ncpanet.org or 1-800-544-7447.